The focus of this presentation is on drug-induced anger. Anger is the absence of pleasure and joy which gives vent to the expression of negative emotional responses. It could be expressed through verbal outbursts, body language, or other untoward actions. Some common causes of anger are stress or distress, disappointment or displeasure, difficulties in handling hard challenges, poverty, hunger, and suffering. It may also be due to loss of someone or something. Other causes of anger include 1. Abuse, betrayal, humiliation, insult, and maltreatment. 2. Bad relationships. 3. Failure and frustration. 4. Low self-esteem. And 5. Lack of capacity for extended logic during a conversation. Research also shows that violent childhood upbringing, past bitterness, past bitter experiences, and poor health and unfavorable well-being can create vent for anger. Empirical inquiries have shown that anger could also be due to hormonal changes resulting from menopause and monthly period for women, mental health disorders among women and men generally. Persons suffering from drug addiction or rather substance use disorders usually do not have strong control over their emotions. Consequently, they manifest mood swings, irritability, and anger that is symptomized by restlessness, unnecessary aggression, anxiety, agitation, and violence. It is important to note at this point that irritability, which leads to anger, could also be due to bipolar disorder, dementia, insomnia, which is also sleeplessness, traumatic brain injury, drug abuse, and withdrawal syndrome. Anger has a mild and severe side. The mild side of anger helps us to ventilate pent-up emotional pressure, while the severe side is often expressed in blinding rage, and that type is extremely self-destructive and can hurt our emotion, resulting into harmful health conditions like high blood pressure, sleeplessness, and headaches. It could also lead to cardiac arrest and outright death. Aside from those mentioned earlier, here are some other consequences of anger as it relates to drugs. 1. It's a strong risk factor for drug addiction. 2. It can mess up the individual, the family, institutions, and communities completely. 3. Drug-induced anger, for instance, could be expressed in antagonism, emotional blackmail, threats, aggression, violence, vengeance, and outright murder. Revenge-spurred anger combined with psychoactive substances like alcohol, marijuana, and narcotics can be pretty much blinding, making it difficult for the angry person to make a balanced decision. Here are some tips on how to deal with or manage and control anger. Number 1, avoid persons and places, circumstances, and situations that may lead you to anger. Number 2, make concerted effort, personal effort, to stay calm under provocation. Number 3, eschew bitterness and be more positive to challenges or challenging life situations. Number 4, respond to verbal attacks with soft answers. Number 5, seek professional care for behavioral therapy. Timothy Legg and Kimberly Holland, both seasoned medical practitioners, suggest counting down or up to 10 to subdue anger. It may also be helpful to subdue anger If you relax your muscles by taking slow, deliberate breaths, listening to music, stop talking, talk to a friend, and embark on workouts in the gym or take some long walks. All said, anger is a very destructive emotion. By it, nations have gone into war. Through it, entire communities have been wiped out. By it, marriages and relationships have been ruined and institutions completely devastated. Many have died and or have been killed out of anger. Like the venom of a viper and the sting of a deadly scorpion, anger uncontrolled is self-destruct and can be more devastating than the rage of a tsunami. If we survive the rage of a blinding anger, the only thing we often take away is regret. So take control of your temper and avoid anger. I want to thank you so much for watching this video. Please share it, like it, and comment on it. God bless you.